Hi everyone, I still remain that public health administrator you know by name is Jennifer. Alright, today I'm going to lecture you people on the topic non-communicable diseases, and I will be giving emphasis on hypertension as one of the example of non-communicable disease. But before I proceed, I would like everyone to understand the meaning of non-communicable diseases. Non-communicable diseases are those diseases that cannot be communicated to others. You cannot communicate these diseases to others. That is what we call non-communicable diseases. And we have many examples of these non-communicable diseases, which includes the hypertension, the diabetes, sickle cell anemia, coronary heart diseases, and many other diseases that cannot be communicated to others. Those diseases that cannot be communicated to others is what we call non-communicable diseases. Like I said at the initial, that I'm going to be giving emphasis on hypertension. Hypertension, is one of the cardiovascular diseases that we have. Cardiovascular in the sense that it is one of the heart diseases that we have. Cardio simply means heart. So hypertension is one of the heart diseases that we have, and is popularly known as high blood pressure. Now, what is this hypertension all about? Hypertension simply means a condition when an individual records a blood pressure of greater than or equal to 140/90 at two different occasions, at least 4 hours apart. That is what we call hypertension. High blood pressure. If you don't call it hypertension, you can still call it high blood pressure. Now, this high blood pressure we are talking about is a very dangerous disease. It's a very dangerous disease that need not to play with. Now, what are the causes of hypertension? We have two main causes of hypertension, which includes modifiable risk factors and non-modifiable risk factors. Examples of these non-modifiable risk factors are those factors that cannot be changed. You cannot change them. It includes the hereditary, the kidney failure, heart diseases can cause hypertension. When you are from a lineage that's always suffer from hypertension, it is very possible that you, as a fetus that is coming out from your mother's womb, can be hypertensive at that moment. You can be hypertensive even though it did not show that time. It can still show in your future. So hereditary play a role in the causes of hypertension. Another cause of hypertension is kidney failure. If you're a kind of person that your kidney is being affected, you will notice that the kidney will find it difficult to release a hormone which helps in decreasing high blood pressure. That hormone is called the renin-aldosterone angiotensin. It is a hormone that the kidney releases in order to decrease the high blood pressure. But because your kidney is being affected, you will be prone to this hypertension. So kidney failure plays a role in the causes of hypertension. Another cause of hypertension is the heart disease. When you are having heart disease, no matter what, you will be prone to this hypertension. That is why it's very important for you to take good care of the heart to avoid you having this heart disease. So heart disease play a role in the causes of hypertension. Another cause of hypertension is diabetes. If you are a diabetic patient, you are prone to this, or you are prone to having this hypertension. So diabetes also is one of the causes of hypertension under the non-risk factors. Now, what are the signs and symptoms that when you are having, or when you observe to yourself, you will notice that you are hypertensive? We have many signs and symptoms, which includes blurring of vision. Blurring of vision simply means you will not be seeing clearly. If something is brown, you'll be saying that thing is black. That is what we call blurring of vision. You will not be seeing clearly. That is the signs and symptoms of Another sign and symptoms of hypertension is throbbing headache. You'll be having a strong headache, a severe headache. That is one of the signs and symptoms of hypertension. Another one is palpitation. You'll be having abnormal beating of the heart. That is what we call hypertension. Now, I want to go straight to the modifiable factors, those factors that can change. We have the stress. Stress is under the causes of hypertension. Stress, when you are stressed out, when maybe you have engaged or indulged yourself in a tedious work, it can make you to have this hypertension. So stress is one of the causes under modifiable risk factor that can cause hypertension. Under this modifiable risk factor is poor exercise. Exercise is very important, but people don't know. Exercise is very important. And exercise also, when you are engaging yourself in exercise, there's this hormone that is released called endorphins. That is the hormone that is released. Is stress feel hormone. Feel good. You feel good when this hormone is released because you have engaged yourself in exercise. So exercise, poor exercise, is also the causes. If you are not engaging yourself in exercise, you are prone to this, to be hypertensive. So poor exercise is one of the cause under modifiable risk factor. Another one is high intake of excessive salt diet can cause this hypertension. Another cause that is under this modifiable risk factor is smoking. Smoking is very bad. Smoking can cause heart disease. Not only this hypertension, there's other heart disease that smoking causes. So that is why it's not advisable for smokers to be smoking. It's not advisable because it endangers the heart, thereby causing what we call hypertension. So smoking is one of the causes of hypertension. Another one is obesity. If you are obese, just know that you are prone to this hypertension. Not only hypertension, there are some heart disease that you will get because you are obese. Atherosclerosis is when there is too much of cholesterol in the heart. It will cause you to have this atherosclerosis and also hypertension. So that is why if you're obese, you should involve in exercise to avoid you having this hypertension. Now, this hypertension we are talking about is measured with a device called sphygmomanometer. That is why it's very important for every individual, not only in the hospital or in the healthcare centers, that this device called sphygmomanometer is supposed to be. You as an individual need this device. At least in the morning before you go out, you check your blood pressure to know if it is low or if it is. So I'm advising you all listening to my lectures to have your own device, your own sphygmomanometer, so that you'll be able to be checking your blood pressure. It will make you to know when your blood pressure is high and when your blood pressure is low. Like for me, I have my own sphygmomanometer, which I use every morning to check my blood pressure. It is very important. Get yours and check your own too. Hypertension is a very dangerous disease. It's a very dangerous and severe disease. So get your own and be checking your own too. Now, what are the treatments? What are the treatments of hypertension? If you are hypertensive, what are the drugs you are expected to drink? I will advise you to drink drugs like the thiazides. So these thiazides are the cyclopen thiazides, or you take the hydrochlorothiazides. These are examples of thiazides drugs. Or you can go for the beta blockers, which includes the propranolol, or antinolol, or even the esmolol. These are the beta blockers. Or if you don't want to take that one, you can still take the calcium hypertension drugs, which includes the nifedipine or amlodipine, are the examples of calcium drugs for hypertension. Another, or you can even take the vasodilators, which includes the hydralazine or hydralazines, or even the diazine, the drugs for treating of hypertension. Make sure you treat your hypertension before it gets complicated. Thank you all for listening to my lectures. Don't forget to subscribe, like, and comment on my YouTube channel. Thank you, and see you in my next class. Thank you all.